Nurse Nick Coleman knew all about the dangers of smoking.
I work in intensive care, and the majority of our patients will have either heart disease, respiratory disease, will have had strokes. All of these things can be exacerbated by smoking.
But despite getting a first-hand look at the problem cigarettes cause, he continued to light up.
I really enjoyed smoking, which is why I guess I was able to do it for so long without actually getting the message myself. Yeah, but you know, you cannot say to someone you've had a heart attack and you've got to stop smoking when your clothes and your skin and your hair and your breath smell of smoke.
Then one day he realized he could switch places with his patients and be the one lying in a hospital bed.
I realized that I could just wake up one morning and not be able to come to work and not be able to enjoy my leisure time, and the smoking may well have been a contributory factor there.
Coleman decided to kick his habit, and now he's receiving support from the Health Services Authority. HSA officials have introduced a new policy, creating a cigarette-free facility.
It's an idea that's been a long time coming. We are smoke-free in our buildings. That was something that was decided a few years ago, but we're now deciding to extend that smoke-free zone to include all our premises.
We recognize the impact of smoking on our patients and visitors, especially those most vulnerable, those who would be sitting in the waiting areas, waiting for transportation, etc. Those are being exposed to the secondhand smoke, and any smoke is too much for our patients to be exposed to. As you know, hospitals are environments of healing and respite, and obviously we want to ensure that we do everything that we can in order to extend that healthy environment. So there's going to be a media campaign which will include messages in the newspaper and added signage throughout the hospital in the areas that are currently used as smoking areas to just raise the awareness, and obviously our staff would then come on board to ensure that we enforce the smoke-free environment.
As a patient, when I'm passing by, I inhale the smoke that they're exhaling. So it's not good, you know, it's really not good. I think it's a very good idea to have this place smoke-free.
It says a lot about the HSA that they're taking the initiative to make the whole area, the whole campus smoke-free. And whether you're coming and going through for pregnancy, like with my wife, if you're coming to the HSA for that, or to be treated for anything, I think it's a big improvement that you can do it in a smoke-free environment. I think we're definitely more aware, and now that she's carrying our baby and we want the baby to be as healthy as possible, to be in an environment where there's smoke, even if it's just for a few seconds, is something that we are very, very cautious about. And she even goes as far as holding her breath when she walks past somebody that's smoking, just to avoid even getting just a little bit of smoke inhaled.
Everybody knows that smoking is associated with cardiovascular disease, heart disease, heart attacks, stroke, hypertension, and of course chronic obstructive pulmonary disease, or emphysema, is very common with long-term smoking. I think what is much less well known is that it really has a negative effect on virtually every body system. There's an increased risk of bladder cancer, for example, oral cancer, cancer of the mouth, the head, the neck, the esophagus, and actually any healing process is inhibited by nicotine. So if you just come in for regular surgery, you have a broken bone, if you smoke even acutely, in the very short term, it can have a negative effect on your healing.
There's no safe level of exposure to secondhand smoke. Immediately on exposure to secondhand smoke, there are certain changes that takes place within the bloodstream and the vessels that in the person who's susceptible, that person can develop a heart attack. This is a study that was done, I think it was in 2004, in a place called Helena in Montana, a citywide ban on smoking. What they found was that after that ban was in place, there was a significant reduction in the amount of persons admitted with heart attacks and chest pain of cardiac or heart origin.
But I have been tempted, when I've smelled other people smoking, I've been tempted to go out and have a cigarette. It's true. It's much better to be a determined quitter in a totally smoke-free environment.
If you're a determined quitter, the hospital can help you snuff cigarette smoking. You can pick up pamphlets like these, or you can participate in a cessation program, which is being revitalized due to the Smoke Free Initiative.